Dr. Fahmi Farah joins us, a cardiologist, the CEO and medical director of Bentley Heart in Fort Worth, and the director of the Global Health Alliance Foundation. Dr. Farah, thank you so much for your time today.
Thank you for having me.
Well, I'm glad to have you. You know, one of our colleagues is in the hospital. He's waiting for a heart transplant. I'm curious about a number of different things, and I'm not sure how this works. I do remember back about 30, 40 years ago, there were tinkering with artificial hearts, mechanical hearts and such. And I was curious, is that still something that is usable or doable, or is that something that was tried and didn't work?
There is something, yes. It's not necessarily a mechanical heart. It's called LVAD. It stands for left ventricular assist device. So you still have your heart in place, and this is a mechanical device that's attached to the heart that essentially pumps for the heart. So yes, in essence, it kind of does work like a mechanical heart. So yeah, it is very life-saving. And for those who are waiting for a heart transplant and a transplant is not quite available, this can be used as a bridge therapy while they're waiting for a heart transplant.
What are the parameters for being able to use this? Do you have to have a certain level of, like less than 10% of your heart usage? And I mean, like, what are the parameters that would allow you to use this?
Yeah, there are certain parameters, and one of the biggest parameters is that you have to have severe heart failure. So essentially, your heart is not able to pump effectively on its own anymore. And as a result, you're symptomatic. You're not able to carry on with your daily activities. You have fatigue, not able to breathe properly, having swelling. So there's significant limitation in your daily life as a result of the heart failure. Those patients who have been treated with proper medications, the guideline-directed medical therapy for heart failure, are eligible for this therapy.
And how long can you use a device like this?
It has very good lifespan, usually roughly 5 years. That's the usual time frame that we use it for. There are two settings where you can use it. Both are, of course, for the same group of people that I just mentioned, heart failure patients. But one group would be for those who are waiting for a heart transplant and are already on a list. Those are called bridge therapy. So in other words, you're using this as a bridge while they're waiting to get the transplant. And the second group of people, for them, it's called destination therapy, because the reason it's called destination therapy is because this is it. Those people would not be, either they're not eligible for a transplant or there's just not a transplant available. In that case, it becomes the last treatment, so to speak.
This is Dr. Fahmi Farah with the Bentley Heart Group. What is involved in a heart transplant? I know the technology has come a long way in 50 years. Where do we stand with a heart transplant now? How simple a procedure is it, or difficult?
It is a quite difficult procedure. When it comes to organ transplant, it's the most difficult one out of all the other types of organs. The other problem with heart transplant is the availability of it. Worldwide, on an annual basis, we typically have roughly 5,000 hearts available on average. So you can kind of, see how infrequent it is to have a heart available for the people who need transplant.
When the operation is done, what is the procedure like? I've always been curious. Because I'm always wondering if something goes wrong in terms of the other heart not arriving on time and something. How do you prep a patient for that, and how does the procedure work?
So usually when a heart transplant becomes available, it's done in a very fast manner, to be honest with you. They will usually fly the heart to the place where the patient is, if the heart is in a distant location. And then, of course, the cardiothoracic surgeon is who performs the surgery. So they will just, replace that native heart with the transplanted heart. It is a very involving procedure. It typically takes several hours to complete. The patient will remain usually in the ICU post-operation, and they usually remain on the ventilator for some time. They require quite a bit of support. A lot of times people require being on extra support besides just the ventilator, such as ECMO, which is another circulatory device that helps take the load off of the heart in the initial phase. So it's a very, very involving surgery. The recovery phase can take quite long, but a lot of people do very well with it. Heart transplant, when it comes to heart transplant, one of the biggest issues, again, goes back to the availability.
When you say, long time for recovery, is that 2 or 3 months? Is that 6 or 8 months? Is that, what, or does it just vary?
It varies from person to person. It also depends on how well they accept the heart, because there is the term, there's something called graft rejection, host versus graft rejection. So if the patient's body starts to reject the heart, then that could be really terrible, because that could make the patient very sick and could have a long recovery period, or it can lead to something more detrimental. But for those who can, who don't reject the heart, they usually do fairly well. And the recovery time, it usually is between 1 to 2 months in the immediate setting. And then, for them to get totally back to baseline, it could take several months.
When you talk about a heart transplant, it's certainly a serious operation. But I'm curious, what do you do to make sure you don't have to have one in the future? What are some good health things we should keep in mind?
Very glad you asked that question. 80% of heart disease is preventable. One of the key things that we can all do are the two important things would be lifestyle, which is what you're eating. Make sure to eat heart-healthy diet. Exercise is the two most important. Stress management, very important. Getting good night's sleep, very important. Making sure basically to minimize all your risk factors such as high blood pressure, diabetes, cholesterol, smoking cessation, minimizing your drinking. All of those will play a role in minimizing and preventing from you ever needing a heart transplant.
There's one last question I have for you, and I keep forgetting to ask my own cardiologist this when I go visit. There's something called coenzyme Q10, CoQ10. Does that really help your heart?
Not necessarily. No, studies have not really shown there's no evidence-based study that shows there's any real benefit to taking that supplement for the heart.
Yeah.
He just threw an entire bottle away, Dr. Farah. Just threw an entire bottle of that stuff away in here.
This is Dr. Fahmi Farah. We'll definitely talk to you again. Thank you so much for coming on for the information.
We appreciate it.
Thank you for having me.
All right.
Okay, take care.